Okay, no Sakin Palumi, thank you. All right, so I think others will join us. So I think we can probably start. Is it okay for us to start, man?
Yes.
All right. So good afternoon, nurses. Good morning, Dr. Adejumo, all the way from the United States. Thank you so much for making time out of your busy schedule, Doc, to be here with us today. Thank you so much. Really appreciate. And to the nurses, good morning to you. It's good to be back again. And this is the second edition of our lecture. So my name is Olumide Obi. I'm the Leadership and Development Coordinator for HED for Nigeria. So we'll go straight into lecture for the day without wasting our time. So, but while we're at it, I'd like to read a brief about Dr. Oluremi Adejumo. Hello, sorry, can you hear me, please? I think I got kicked out.
Yes.
All right, thank you. All right, so Dr. Oluremi Adejumo is an assistant professor at the University of Maryland School of Nursing and a former adjunct professor at Johns Hopkins School of Nursing in Baltimore, Maryland. Her primary goal is to help strengthen the nursing capacity in the United States and abroad, making prevention a priority, most significantly in Nigeria and other African nations. As a translational leader, she has facilitated many community-based projects development, even in a complex adaptive system. Her expertise lies in translation of evidence-based research to practice. To share her expertise, she mentors other nurses to be more effective and efficient in their practice delivery as they perform patient-centered care. As an initiative-taking leader, I aim to empower other nurses is evident in our engagement in nursing activities that foster professional growth. When Dr. Adejumo recognized the threats of substance misuse to the citizens of Nigeria, within a short duration of our membership and engagement with the International Nurses Society on Addiction, NSA, she facilitated the establishment of the first chapter in Africa, NSA Nigeria, as she works collaboratively with our nursing colleagues and healthcare profession from other disciplines. Without wasting time, ladies and gentlemen, please welcome with me Dr. Oluremi Adejumo. Thank you so much. And over to you, Dr. Adejumo.
Thank you so much for the introduction, and I'm so glad. When I was asked to present over, on this platform yesterday, I thought it was a pleasure for me to be here, and I'm really excited to be part of the team today. So the discussion, not to waste time, the discussion for today's platform is going to be an overview, the substance use or dependence in Nigeria, in which most people will say, addictions. But addictions is not only on, there's so many behavioral addictions that citizens of Nigeria and other nations experience. But we are focusing on, our focus today is on like prescriptive and non-prescriptive medical like addictions. So the next slide is going to go over the overview. So for this, at this point on this platform for today, we're going to be, the first thing is we want to define what substance use disorder is, and then identify the commonly used substances in Nigeria. We also want to know the impact of substance use on dependence in Nigeria. At the same time, be able to know understand the risk factors, and how the brain mechanism for substance use in adults and in children or adolescents. What is the problem? Or what kind of consequences will addiction cause to the brain mechanism of those individuals or populations? And then we will discuss about the current prevention or treatment practices in Nigeria. And the last but all, we will be discussing about the best practices in treatment that should be happening, that possibly we're seeing some and we're not seeing some in Nigeria. So I'll go to my next slide. The first objective is introduction of what is addiction itself. When we're discussing about addiction, some feel like it's kind of very like the use of the word addiction in the medical term, like in the US, they're trying to refrain from the use of addictions, even in the UK. So because of that, they came up with the terminology of substance use disorder. So instead of using addictions, because if you look at the term, it's kind of derogatory. So we do not want to use that. We want to use the term substance use disorder. And we know, based on our experiences in Nigeria, that this is a serious public health issues. Then we also want to understand that addictions, like some people call it, or substance use disorder, so I will use the two terms interchangeably so that everybody on this platform, because they're used to the terminology of addictions, it is a primary and a chronic brain disease. Why do we call it primary? Because the medication itself can change somebody's, an individual taking the substance. It can change their body composition, especially in the like the brain composition. So it may be very, very difficult. A lot of times when they're experiencing what like the recurrent use, they have no idea of what is going on within themselves. So that is why it is a chronic brain disease and it occurs with recurrent use, and it could be alcohol. It's not necessarily drug like cocaine, cannabis, or other forms of substances that we're used to calling addictive substances. So alcohol is a commonly used product in Nigeria, but it could be addictive as well. So the goal is, what makes it an addictive substance? It has to have a recurrent use to it. And then despite the manifestation of physical problems, the individual engaging in an addictive process will still want to use, or will still want to use some more to make them feel better. So that's what makes these substances different from other substances that we use either medically or with prescriptions or non-prescription. And there's a strong association with between substance use disorder and mental health problems. And even so, not only mental health problems, other chronic, non-communicable chronic diseases too. So the first thing we want to also do is to be able to, how do we diagnose, or how do they come up with the substance use disorder? When you go to the UK, because I know Nigerians, we use the terminologies from the UK, and it's different from what they use in the US. So I have the two terminologies here. In the UK, they call it dependence syndrome. In the US, they call it substance use disorder. So depending on where you're practicing, and I think the same thing in Nigeria, the word dependence is the most commonly used. They're trying to refrain from addictions. And as you can see, the two boxes, right? It both have replaces, and then it has addictions, they're using the word dependence to replace addictions. They're using the word substance use disorder to replace addictions in the US. So the background, substance use disorder is an epidemic problem all over the world, but it's more prevalent in the low to middle income countries. As you can see in the US, by the United Nations Office of Drug and Crime, in 2019, 35 million people around the globe use substances, right? These substances are considered based on the pharmacological content. So the classification of cocaine may be different from the classification of opioids. That's what that means. Substances may have social or economic or health impact or consequences on individuals. So recurrent use of these substances could be very detrimental to the health of the nations. It could be detrimental to the health of the family members, and it could be detrimental to professional group at large. So the commonly used substances in Nigeria, we have nicotine, which is cigars, right? Alcohol, wine or distilled liquors, depressant, benzodiazepines, such as Librium, Valium, or Xanax. And unfortunately, these items could be, because of the issues with the pharmacy, anyone could go to the pharmacy with no prescription to get some of these substances. So because of that, easy access to them, it makes it easy for citizens to have issues with recurrent use. The stimulants are cocaine, amphetamines, methamphetamines, right, and methylphenidates, which is also known as Ritalin, that they use in treating ADH. So we have cannabis, like marijuana, hashish, ash oil, or edible cannabinoids. So these are commonly made in the local areas in Nigeria, because we have the seed, and we have it's like grown in some areas of Nigeria. Then we have the opioids, which are heroin, methadone, buprenorphine, oxycodone, Vicodin, and Lofab. The hallucinogens are sometimes also used, but I'm not sure whether those ones are very commonly used in Nigeria. But ecstasy is also very, very common. Now, the problem with us in Nigeria is that the substances, there's an increase in the use of these substances. And that's the reason why we're seeing individuals between the age of 15, high school, to like probably less than 50, the rate of addiction that they're calling it, it's really, really high. We want to find out why is it. So based on the UNODC, as you can see, can you see the screen very well here? I have to minimize this. Can you see my screen?
We can see it clearly, ma'am.
Okay. So based on the United Nations United Nations Office of Drug and Crime, in 2019, the rate of use in 2006 as compared to 2016 has gone up higher. It's more than twice the rate compared to when it was in 2006. We want to wonder why is this, right? So in 2006, we have 5.6% increase from ages 15 to 64 years old. And then 2016, it went up to 14.4. There's a huge, there has been a huge surge since COVID, and the rate has increased, but we don't have a current data on that yet. Because during the COVID, individuals using substances, they didn't have easy access to these substances because the transatlantic market was shut down. All the global markets were shut down, where the access to drugs, to these drugs, were from the transport from the countries to different countries. The route was shut down due to COVID-related closures at the time, pandemic closures. So individuals did not have access to this, to these medications or these substances. So they resulted in making, homemade substances, and we'll go over that too. So the impact of these substances in Nigeria, As you can see, based on this screen right here, the men are 21% in rate, whereas the women are about 7% rate. The rate in women is, when I saw 7%, I was kind of scared. And unfortunately, the harmful substances also have been noted in women in antenatal care, receiving antenatal care. What does that mean to us? Even thinking about that, when I looked at this study, it was frightening. So the misuse of harmful substances also noted among the nation's adolescents. These are high school students. And we wonder what is going on in Nigeria. So the consequences, high demand for healthcare in a nation that is already predisposed to poor or low financial problems. Individuals could not have, the adequate health care because the government do not provide preventive health care. So what can we do? So the first question, I want this to be as interactive as possible. The first question I want to ask you, based on you being in Nigeria, just let's kind of do a guesswork here. Which region would you think has the highest prevalence of substance use disorder in Nigeria? I need help.
I think the Southwest.
Southwest, okay. So I believe you're correct. So let's look at it and we'll look at the rate. So the rate is higher, right, in the Southwest and the South region. Individuals, people, like the majority of people, when I was asking them these questions in Nigeria before, when I had this presentation one time about 2 years ago, the response was, oh no, it's the northern area. The Hausas have problems with addictions. Yorubas and Igbos, they don't have problems. Look at what we have here. So Oyo State, Ekiti, Ondo State, Osun, Ogun, and Lagos State. And then we have the Edo and the Bayelsa rivers. These are the areas that have the highest prevalence of substance use disorder in Nigeria. And why is so? Because cannabis is easily grown in those areas. And then you can see here the proportion for each one of the regions. The North Central and the Northern area, they're way, way lower compared to the Southwest area, which has like 22.4%. This is huge, right? And this is an area where most of us here, based on the name that I'm seeing, these are the areas that we represent. So in 2017, right, when there was a study that was done, asking questions about the most prevalence of the drug, which one of these items, substances are most prevalent used in Nigeria. Cannabis was #1 of all the drugs, and opioids #2. And the reason why cannabis is #1 is it's grown locally. Opioids, we have easy access to the pharmacy. Anyone can go to a pharmacy to purchase opioids with no prescription. So these are the main issues that we have. And then when you comparing, like women to men, look at the rate in men and look at the rate in women too, right? The use in men is like 18.8. And then the use in men also for the opioids is like 6, so it's way higher. But you know what? Look at the opioids use. The women are, they are riding along. So we can't say it's a male problem. It's women and both men and women's problem. Then the other area that we have a problem in Nigeria is the inhalants of solvents. And based on the studies that I read around the COVID time, more and more people are using the homemade. They're even sniffing in the hydrocarbons from gutters because they couldn't get access to the regularly used substances. And then when we're looking at, based on women and men category, as we discussed about, see the prevalence table. I mean, this chart here for the male and the red one is for women. We are climbing along as well. So this table right here, when I looked at it, really got me very, very frightened, even more than ever before. And I want to describe this to you. The red one, as you can see on this table right here, is the cannabis use. We have the, this color right here, it's like brown or light brown, is the cough syrups use. So before, we've always been told about cough syrup and cough syrup with codeine, But the problem is, it's not just cough syrup with codeine, right? We can look at it, the green is pharmaceutical opioids. We have the heroin, right? And we have the gray items, right? But when you look at the cannabis use, look at the, for this age group category between 26 to 34 years old, does that scare you enough? And then we will always assume that, elderly patients, oh no, they don't have problems with addiction. They are on it too. 60 to 64 years old, 8.4. That got me really, really scared. So do we have a problem that we as nurses, need to fix in Nigeria? Because, our model is prevention. And unfortunately, when you look at the ratio of medical doctors to patient population, and then we look at the ratio of nurses to patient ratio, we can do a lot, make a significant impact in the patient populations or the citizens of Nigeria. So the problem that we have is, Nigeria has been ranked number 3 in the world with the prevalence of cannabis use, and because it's locally grown. So we see all these guys, the vehicle, the commercial bus driver. There was another article I was reading about commercial bus drivers. The rate of use among them was like 81%. That was, when I read that, I felt, oh my goodness, these are the people that drive us around all the time. Are we maybe able to make any impact, within this population? So why is Nigeria number 3 in the world of prevalence, high prevalence of cannabis use? Because we have tropical climate that improves the growth or propagates the growth of this substance, right? Even despite the fact that Nigerian federal government have banned on importation or cultivation of these substances, but because of our corruption, right, it's still been grown. We have Indian Hemp Act of 1966, but still people are disobeying those acts and they're still growing this, cultivating this product in Nigeria, in the South and the Southwest area. And then we've seen a lot of deforestation. So they are cutting those trees off and they're still making use of them in another form. Some could make it in the sniffing form. They could also use it with meal, like in regular meals. They could also use it in the, what is it called, like tea bags. So this question I've already answered. The question is, why is cannabis the most widely used in Nigeria despite laws prohibiting its cultivation, importation, sales, or use? So the answer for us here is that, when farmers could not get anywhere with their own profit, every single person will make a way to have profit because they have to fend their families. But you know what? This is an illegal way of fending families. Then our politics, unfortunately, we have politicians that really, do not put primary prevention as priority. Then we have the corruption, and then the gain of profit over women's life. So the area that I would also like to discuss is that we discuss about why is cannabis. So we want to zoom into opioids and cough syrup. The heroin used in, is an opioid drug. It's made from morphine, a natural substance taken from the seed called pop or opiums or poppy plants. We know that we've discussed in the earlier slides about the porous pharmacy. I could go to the pharmacy and get any of these items from the store. And unfortunately, there was a party that I attended a long time in Nigeria, about 5 years ago. There were people that were putting Tylenol with codeine, cough syrup with codeine in like soft drinks. It was really, really bad when I saw all the empty bottles of cough syrups with codeine at the party. And that I was told that when I asked, oh, why do we have all these bottles? I was told, well, just don't worry about it. This is our norm in Nigeria. This is not a good norm. Then the other reason is we have siloed agencies. We don't work together. Nurses don't work with doctors. Doctors don't like to work with nurses. Pharmacists want to be like, parity. What we think about is about our position in the society rather than helping the society that brought us up until this level. So we have a huge problem to deal with in Nigeria. And I think it's not just about the leadership, it's every single one of us. We have a part to play in helping the citizens of Nigeria. So we should be concerned about what is going on, because at the end of the day, when somebody who is a teenager, who has been using all the substances from years, probably like 10 years old or 12 years old, they get in the car and they have a gun, and we're scared. We can't even go to sleep. We complain about security issues. These are the causes of the security issues that is alarming in Nigeria as of these days. So we should be worried, and together we can make a change. It's not only one particular discipline. It is important for us to work together, because if we don't work together, this problem that we have right now, that substance use disorder, dependence on substances, like you're going to use the UK terminologies, or addictions, if that's the terminology you want to use, right, will continue to pose a huge problem in Nigeria. I want to be able to come home to Nigeria and sleep comfortably. But unfortunately, these substances, right, they are creating increased or alarming security issues. People are leaving work because they can at work right now. Absenteeism because of the substance use is increased. Productivity of work at workplaces are decreased. Crime is on the rise. Injury is on the rise. We discussed about the bus drivers, right? Commercial bus drivers. But, when they were asked questions about substance use, about 81% of them says, testified or said yes to the use of substances. This is really, really scary. And unfortunately, right, some populations in the society, they are stigmatized. So if I have problems with drug use, I may not want anyone to know about it. But unfortunately, the issue is not about stigmatization. It's about the fact that we are just ignorant about the care of individuals that are having these problems. Because it cuts across all health disciplines. Nurses are using substances, doctors are using substances, leadership are using substances. So it doesn't leave anyone out. There's really, everyone is included in this matter. So we all have to deal with it together. And unfortunately, the other sad part of it is that increased use in substances has increased comorbidities requiring high medical costs. There's an association, a huge association with substance use or addictions or substance use disorder and mental health. There's an association with substance use disorder and diabetes, which is the high non-communicable prevalence in Nigeria right now, which also can lead to many other issues like heart attacks, stroke, kidney failure, blindness, amputation, and so many other problems. So we're looking at this now. If I ask any one of us here, do we have any family members, or do we know anyone at all that we can say, oh, I know somebody that is using substances or has issues with substance use disorder? Majority of us on this platform right now will say yes to it. Could it be alcohol? Could it be cannabis? Or could it be Tylenol with codeine stimulants? Could it be any that you can think about of the ones we've listed in the previous slides? As we discussed about in the last slide, substance use disorder, there are consequences to it. It affects all body organs. As you can see, there's an impact, with the lungs, with the heart, with the GI system, with the liver, with the gums, with the eye, with the limbs, right? So, and the other problem we have when we're discussing about substance use disorder, some that is commonly used that I think I didn't put on this slide is, has anyone heard of Alabuco? Have you heard of Alabuco in Nigeria, or is it still, I believe it's still in use?
Yes, the white substance sachets.
Okay, it's commonly used, and Alabuco, when you look at it, right, it has like 760 milligram of acetylcyclic acid, and it also has about 60 milligram of caffeine in there. That's huge. Pregnant women take Alabuco, for back pain when a woman is pregnant, right? Because of the advancement in the fetal growth, there's a curve in the back that really cause, sometimes cause pain in the lower back for women. Some of these women use Alabuco in the morning, at night, in the afternoon, every time, and we have stimulants in there, right? So a lot of the use is due to chronic pain. Some are using it because of asthma. I've heard people using cannabis, like in the tea form, to prevent other communicable chronic diseases like hepatitis and and HIV. And as we discussed earlier, also diabetes is also an associated non-communicable disease that is maybe a consequence of substance use, because there's a correlation there. And there's a correlation between heart disease also and the use of stimulants, and high blood pressure. But as you can see on this slide right here, right, majority of the people that were, the people that were provided the questionnaires by the UNODC's report, right, claimed that about 50 or close to 150 of them, right, on this, as you can see, all the items that we discussed about no drug use is the red one, all the substance use is the black one. Look at it. So they are not only using one, right? They're using multiple. And then if you look at it, cannabis is right here, and then we have other substances there, they're mixing together too. So when we're discussing about polysubstance use or polydrug use, they are using multiple. So not just Alabuco, they're using Alabuco, they're using cannabis, they're using Tylenol with, cough syrup with codeine. They're just mixing everything up. Now, so this brings us to these challenges that we have as citizens of Nigeria. When I'm using it, or my mother uses it, right? It affects me as, in my fetal, when I'm growing in my mother's belly, or during the fetal growth, right? Or advancement, you call it. As you can see, there's a biological or genetic component, and there's environmental issue, right? So the genetics is something that we can change, because my mother, perhaps she used a lot of stimulants when I was growing up. It will eventually affect me as or any of the substances as a newborn, right? We have newborns, and they are discussing about newborns or new infants or infants with colicky problems, and we're giving them gripe water. Are you familiar with gripe water? Is anyone here familiar with gripe water?
Yes, yes.
Okay, so what I would like for you to do, when, maybe next time I'm going to bring something back to you, I would like for you to go back in your pharmacy and look at constituent, what is in gripe water, so that we can discuss it again. because we're taking all these things, and these children come, after bath, they're crying, and they're sleepless. Could it be possible that they're going through withdrawal syndrome from their mother use of substances as well? Because their parents are, their mother, most often in antenatal care, women are not screened for substance use or if they're using any substances at all. And then it's based on biological. We discussed about the genetic, we just discussed about gender, and we discussed about the mental disorder. But you know what? There's an environmental impact of it too. Something that we don't really realize as a society is that early use or availability of these substances to little children can be of a detrimental effect to the child. Because why? Their brain is forming, and then I think in the subsequent slides you'll see how that occurs, right? So it is important for us, depending on the availability at the age or the age of the use, could result into maybe it is possible to for them to do well in rehab, or is it possible for them not to to have long-term effects, even thinking about mental disorder like schizophrenia, right? One other thing that is very common in Nigerian family homes, we're discussing about environmental. A child being exposed to the father or the mother always fighting, right? Chaotic home, an abusive home, parents' use or attitudes at home, peer influences, right? Community attitudes to other people, and poor school achievement. So these are the areas that we need to look at in society. We start thinking about this. Do we have any impact or any way we can influence a change in these areas? If you're a young guy, you want to make sure that, thinking about it as you're getting married, as influencing change in your society, in your little local area, we can form a group of, we don't have to expect leadership to do everything for us. As you can see, the drug impact, we have a drug, it goes to the brain, and then it results in addictions. So now, the brain mechanism is what I'm going to think about. This is the way I would like for you to think about it. We have dopamine, right? When I eat some food, and the food is very, very, I like the food a lot. I want to eat some more. I want to have some more of that food. As I'm having more of that food, I'm releasing dopamine. It's like it's hormone that goes, secreted from my body. It just goes in my brain, right? The increased rate of the dopamine differs based on the drug that is being used. So when I like some food, the dopamine is released. If I'm the kind that likes sex, dopamine is released. If I'm the kind that likes cocaine, dopamine is released. But one thing you have to realize also is that the increase in dopamine varies based on the drug that is the kind of drug that is used. And the more the dopamine is released into the brain, the more that I want to have some more of that to make me feel good. And then the more I'm feeling good, after some time, my body gets dependent on that, because the amount of dopamine that is released, I need more of that substances to keep me feel good, to make me feel healthy. Is it clear how this addiction, how people are addicted? Now think of this, right? Repeated use in a little child, a 10-year-old that has a brain that is just forming, right? And we'll look at the brain picture. There's a little video here that tells you more about the addiction. So these are the brain and the dopamine released in the brain. So while I'm eating, the dopamine is released. You can see it's not much of them. But compared to what I see here when I'm using cocaine, see how the dopamine is overwhelmed, how my brain is overwhelmed with the amount of dopamine that is released due to cocaine. Now the question is, are we able to change this over? Are we able to, can we reverse, is this problem reversible? So that's the area we want to look at right now. As you can see, we have binge drinking. Some people are, the drink binge when you take high intake of alcohol or of vodka. Maybe because you're upset, I just want to drink and I'm drinking a lot. So that's what we call a binge. And that will result in intoxication. And it could also cause a withdrawal effect, right? As you can see the stage right here, we have the binge drinking, then we have the withdrawal effect. Then right here is this area of my brain that is thinking about, my frontal area of my brain is thinking about, oh, I need more of that to keep me feel better. I need more of this to keep me feel better. And that's the reason why a lot of people or a lot of our citizens that have issues with addictions, right? Substance use disorder, they have no clue of what is going on because dopamine increased in dopamine rate in their brain has overwhelmed the brain that they can't think, they can't have good judgment. So this is where we are in Nigeria right now. The people that we are sending to the rehab center, like neuropsych arrow, like the other data units or the rehab centers in Nigeria, right? It's only about 10% of the population that we know that are using these items. The remaining of them, the remaining part of them, they are just under the water, they are hiding. So more than 65% of the people that are experiencing addiction problems in Nigeria, they are hiding. They're not going into the rehab center for two reasons. The first one is stigmatization. I don't want them to know that my child has problems with addiction. I don't want them to know that my father has problems with addiction. I do not want them to know that my mother uses heroin and she shoots drugs. I don't want anybody to know that, you know what, oh, we have families that is well recognized in Nigeria. So I do not want to tarnish the family image. Now, the other part is the finances aspect, because Nigerian leadership do not provide finances to help resolve this problem because there's no prevention. You as a family member has to actually support your family member to take them to the neuropsych arrow, and you have to pay 100% at the point of care. So if I don't even have money to eat, will I have money to help my loved ones to get for rehab? So the consequences become severe. And then we see people attacking other people, and we think, you know what, the government have to do this. Well, the government is not taking their part. So we the citizens, we have a lot to do. So think about it. The people that we're seeing in the rehab centers is only 10% that goes there. The rest of them are still here. And that's what results in the mental health, like schizophrenia, other mental health problems, depression. And then we wonder what is going on. So our responsibility as nurses, when we get, to receive our licenses, we are, the first thing is that we are to care for all populations, to care for everyone, right? So we need to realize that substance use disorder is a long-lasting and a complex disorder. Even with rehab, they can relapse. Because think about it, somebody who started using substances because of the hopelessness, they don't have money to take care of their family, and they're drinking alcohol, they're drinking all these things in the morning every single day, but they're using substances just not to take their mind off or to take their mind off what they are thinking about, right? And then we'll discharge them from the rehab, and then we'll discharge them back to the same hopelessness or no job or the same family or friends they were encountering during the process. Do we think they're not going to relax? They will relax because the brain still remembers the joy that they used to receive from, they call it euphoria, that they used to receive from those substances. So they will remember, if they are smokers, they will remember how it makes them feel good, right? So we're discharging them back to the same hopeless situation. Of course, they're going to relapse. And that's the reason why we have a huge problem in Nigeria. And the only way we can fix those problems are our responsibility as nurses. We did, yesterday we had the International Nurses Annual Nurses Week. Annual Nurses, what is it called? Month yesterday, and then a couple of days ago we had the global nurses. In the US we have the Nurses Week too. So we just don't think about the Nurses Week. Let's use the 2022 Nurses Month to improve our society. We can do a lot. We can't rely on only the leadership to do this. we start providing information to young kids that, the best thing is for them not to even taste it or not to even indulge in it at all, right? It affects every component of every human being, their mental wellness, the social wellness, academic wellness. They're failing in school. They become, they don't, they will not be going back to school because instead of them attending classes, they're looking or seeking ways to indulge in all these substances. It affects the financial wellness. It affects the spiritual wellness. So it is our duty to provide evidence-based treatment. And treatment is not just about treatment. We have to address the whole person. Because if I have a problem, you're just thinking that, okay, relieving me of the drug use by treating me or counseling me, we just do it. That alone would not do it would not resolve the problem, because it will just result back when I go back to my formal environment. We have to reduce the stigma. So when you see someone who have problems with substance use disorder, we just don't want to stigmatize them and say, oh, start calling them names, because we want them to come to us. We are their protective factors. So when we see patients recovering, we want to help them. Find out from them how you can help. To support them. We want to encourage. If we ourselves also need to know about what is available in the society in Nigeria, so that we can refer them to appropriate resources. If we don't know, how can we refer them? How can we show them where to go if they need a job? How can we show them where to go if they need healthcare services? How can we show them where to go if they need housing? So, as I was discussing about earlier, right? Look at the brain. We discussed about how the brain is affected significantly with substance use. This is the healthy brain, right? You see the control of the brain. This is the red part of it. They call it the limbic system. You see that is showing here in a healthy brain. Healthy brain that has not been messed up, or that has no influence of substance use. See, that has it's intact. The limbic system is intact. But look at in the patient with addiction, right? It's all faded off. We are only seeing like real fade. That's the reason why they don't have control of themselves. And then when they go to rehab, it can come back, but it will not be as before. But it's still, this was a kind of a brain that they were showing, just to see, just to inform of how the brain mechanism works with somebody with prolonged use of drugs, and then someone with prolonged abstinence, right? So we can revive them. They can be rehab, the rehabilitation work. But our role as nurses is important for us to know that the way we communicate with them, the way we stigmatize, we have to reduce that, so that we want them to stay in this category for a long period of time. And our embracement of of them as an individual, as a human being, is important. So we want to make sure that we provide adequate services, collaborating with the medical doctors. And for us to collaborate with medical doctors, we ourselves also have to be on the par. We have to indicate that we want to continue like lifelong learning, right? It is important for us to know that we can't rely on the fact that treatments will be adequate, especially for somebody who does not have insurance and the government doesn't pay for it, and then they don't have the money for rehab because they have to pay 100% at the point of care. Unemployment too is on the rise in Nigeria, and that also by itself, just solidarity by itself, can predispose an individual to substance use disorder. Impoverished environment, and then undereducated, like the bus drivers. Sometimes they're taking substances because somebody tells them, oh, this worked well for my disease, and then they result in doing the same thing because they don't want to go to the medical doctors or to medical care. Then the fear of stigmatization is also important. It's also important for us to be aware of, especially in women. Somebody was taking a very beautiful young lady to the rehab, and one of the counselors was asking her, "You, ma, you. So what makes me, ma, different from other people, right? Because she was a woman, or was it because she was a young girl?" So this our stigmatization, the way we approach things, have to change, right? And then the best way, as we discussed earlier, we can't change the policy by ourselves, but we can start thinking of how to make changes in our society. How we can make those changes is we have problems all around us, right? We do not need to wait for international members to find the problems and to fix the problems for us. We can make a change a little step at a time, right? Failures to adopt evidence-based, as we used to do it before. This is the way our grandfather did it. There are evidence out there that shows that if we use research to inform us of treatment or how we care for patients, it will more than likely that we'll have a very good outcome. But if we just do it based on our forefathers, we may not have good outcomes because without evidence, we cannot implement the best approach to care. Then the cultural attitude, stigma, as we discussed and we've discussed multiple times, have to change. Then nursing scope of practice. If I ask you all, I believe based on what I was informed, you're all nurses. Do you know your scope of practice in Nigeria? Do you know what extent to what your practice, your license can allow you to practice? Is this important for you? If you don't know, I think it's worthwhile, it's very beneficial for you to maybe call the nursing board the board of nursing in Nigeria, or the council, they call it the nursing council, for you to have a copy of the scope of practice so that you know what you can do as a nurse and what you cannot do as a nurse. How can nurses help? We can help like we've discussed about. The primary way a nurse can help is promoting basic understanding of substance use. In your little area where maybe your community or rural area, you can go to elementary school, which you call primary school, secondary school, even the colleges, and start to preach to people, educate individuals, educate students on that, the drug of substance use can, a detrimental effect of substance use and the consequences, not to just the family, because my neighbor is using drugs or is on heavy drug or, is becoming a nuisance in the area. It's going to, no matter what, will affect me as a neighbor. So it's not just about family members. How we have to make an impact in our family, nuclear family, in extended family, in the neighborhood family, and the nation family at large. So basic way for us to move forward is basic understanding, teaching, and informing people of how substances can affect and what we can do. Thank you. And let me see, do I have anything here? Okay. Oh, thank you. Any question?
All right, thank you so much, Dr. Adejimo.
Are you welcome?
Wow. So just for you to know, this is actually a very interesting topic and presentation. Like, I was meant to be somewhere, so I was supposed to start this lecture and why the coordinator, Nurse Falashade, the nurses coordinator, was supposed to end it. And also the roots too. That's the admin officer. She was also supposed to leave too, but no one will hear this and leave. Like, these are things that happen in our society, things that happen all around us that we see every day, and we are really, really interested in it. And so thank you so very much, Ma, for this wonderful presentation. God bless you, ma. So nurses, questions, observations, and no, please, the floor is open. So, and if you are in a noisy place, I think there is an opportunity for you to drop your questions under the chat box, please. So we can.
Miss Salami have a hand up. Yeah, go ahead, Miss Salami.
I think they can unmute themselves as well.
Okay.
Good afternoon, Ma. Thanks for the presentation, wonderful presentation. My question is, how can a substance use be detected in an antenatal patient?
Okay, good point. So in the US, what we have, they have urine tox screen, because we have toxicology screening, and then sometimes they do the blood work. If it comes positive in the urine, they want to know the kind of, what is it that they have in the blood, in the urine, right? So extensive testing, drug testing could be done via the blood, like serum testing of the, or to be able to identify the particular use.
All right, thank you.
You're welcome.
Thank you.
Any other question? Okay, the question here is from Ms. Folasade. How can we help someone that is ready to withdraw from addictive substance? How can we help them, right? There are various data centers in Nigeria. I'm affiliated with some of them because, I work with the International Nursing Society on Addictions. ARO is one. There's one in Ilorin. Pretty much all the states have the federal, they call them the data, drug addiction, rehab, rehabilitation, rehabilitation center. I don't know, I can't remember what the data stand for again, but it's a rehab that is federally, is the federal government facility, and they are available, I believe, in almost all the states, I believe about 36 of them. So the cost for those data centers is a lot less compared to a private practice. Then one other thing is the person that you taken there may need to stay there for a while. So they still have some funding, that it's, that in the payment that is required, but it's not going to be as high as the private practice. Now, how can you help somebody going through withdrawal? Unfortunately, we can't help somebody going through withdrawal without knowing what they are withdrawing from. Because the treatment, let's say for somebody taking cocaine, is going to be just different from the for an individual using for instance, opioids, right? So every single one, so they have to first identify the substance of use, and based on that, they will be able to treat appropriately. Another instance is, let's say you have somebody who is drunk and they're going through withdrawal and they have seizures from alcohol. Usually the treatment here, we give them thiamine, we give them folic acid, and then we give them multivitamin. It's a combo. And then we also treat the aggressiveness by giving something like Ativan just to calm them down. But you cannot do the same for other substances. So in essence, the treatment is based on the first identification of what substances are they withdrawing from, and then secondly, that probably will be identified through blood work, urine test, and then secondly, they will administer treatment to prevent withdrawal and to prevent seizures, because most often it results in seizure disorders. Any other question? Good. Ms. Salami, do you have another question? How about common among youth in the rural communities. How do we convince to change their minds when they claim it works? Of course, they will claim it works, but providing them with information, but we cannot provide them with those information without knowing about it. See, my background, to be honest with you, my background was not in addiction. I used to work in the ICU, PACU, tele units. And I came to Nigeria and I saw a problem. I came back here and I started to read about it. So we have to keep ourselves informed, not people just telling us or someone telling us all the time. We have to be reading about the issues in our community. And by being well informed, then we will be able to intervene appropriately. So if you know the constituents of the herbal that they are taking, right? You want to inform them about, because when you have herbal, it could be a mix of so many things combined together. You want to find out first. You want to find out from them what are they mixing together, and then based on that, you may want to educate them. So this is, if you take this medicine or this one, it causes this problem. If you take this, it causes this problem. And it's not about, the most important thing you want to inform them about is that it's not the immediate gratification that they need to think about. It's the long-term effect that they need to be worried about. Thank you, Ms. Luru. Any other question?
In addition to that, the Nosluro's question. So what is that so common here in Nigeria, especially the Southwest? For example, there was a particular time where someone had, is it typhoid or malaria? The person went to the hospital and they prescribed antibiotics and anti-malaria drugs. And after finishing, completing all the dosages and all, the person was still feeling sick, still symptoms and all. So after some times when the person didn't get better, so an elderly person now advised that they should use herbs. So they had oranges, leaves, bark of trees and all like that together and all. So and they cooked, and the person took the dosage. So the person took in the morning and then in the night. By the time the person woke up the next morning, the person was healed and healthy. So they just said, take it the next day again and do that. And without sincerity, the person actually felt so much better, resumed back to work and all like that. So that kind of person, how can someone convince such person who probably got first-hand experience of how the herbal drugs, the herbal concussion works, and how against the the tablets and the drugs and all like that? How can we convince such?
Yeah, so that's a good, I understand what's going on, but unfortunately, right, there are two things with herbal treatment, right? There's no measure to it, number one. But number two, I want to find out what they're mixing together. It's okay for us to use the herbal because I think that's the trend in Nigeria right now, because in fact, Lagos State Health Department, they have a designated department in the health sector in Lagos State that is focused on medicinal, herbal or traditional medicine therapy, right? But I understand because if I've been dealing with malaria for a couple of months or a couple of weeks and it doesn't, all the pharmaceutical medicine none of them was able to cure my malaria. And then I drink Agbo one time and it's healed, then I want to resort back to it again. But I think when we're discussing about addiction, what is important is what is being mixed together. I want to know the leaves. If it's oranges, yeah, it's okay. But at the same time, people have to be very, very cautious. That's what I'll tell my patients or my clients. They have to be cautious of the amounts they're using because we don't know. There's no particular dosage. And then if you take too much, it may affect other organs too. you know, because we don't know how the concentration of what is being mixed together. There's no measure to it. And it may be difficult, like you said, because the one thing you also have to realize is that is a person, the medication is it being purchased from a reputable pharmacy, because we have a lot of homemade pharmaceutical products, right? Like when I'm in Nigeria, I don't buy medicine from just anywhere. I have a specific place that I purchase my medication from if I need to. So, you know, because there are some places where you have to purchase your medicine, or you may purchase your medicine and they have counterfeit with the mixed up with the original medication. So, you know, there's so many factors to put into perspective here. So just the fact that the pharmaceuticals doesn't work, I'm not sure. Is it original medicine? Is it an original medication, or is it like fake medicine, like the so-called? Also, some youths in Nigeria are involved with difficult jobs like bricklaying, digging. Yes, they get involved in drugs and later get addicted. Yeah, this is true. So this question is coming from Falashade. Yeah, it is true because of the hard labor and the stimulants, you know, like the one I was telling you about, the alabukun has a lot of stimulants in there, right? It's like you're drinking caffeine. And some of these medications also, they stimulate the body and makes you feel like you're very youthful, like very strong. And that they may want to use that. But, you know, at the end of the day, right, what is important for us to inform them is there are long-term consequences to these medications, and then we just want to let them know so that the use can be reduced, because continuous or recurrent use can result in psychiatric problem, like schizophrenia, like so many other psychiatric mental health issues. So we want to avoid that at all costs. There's a prescribing herbal therapy for stroke patients here too, and it's really hard to convince people to opt for orthodox treatment. They say it's traditional. Yeah, you know, unfortunately, a patient who has stroke, I'm not sure what they're trying to, are they trying to improve the deficits, or are they trying to, because they already have the stroke, what are they treating? So that's the question to Luro. Luro, can you, because I'm not understanding why the treatment for herbal therapy with a stroke patient, how effective that could be, what are they treating? Are they treating the deficits from the strokes, or are they treating the stroke itself? I'm not understanding what those are for. I've never heard of that. So can you explain, Luro? Adiola?
Nurse Luro, are you there?
I think can she unmute herself? Will she be able to unmute herself?
Nurse Luro, hello, are you there?
Oh, managing paralysis. Okay, yeah, she's here. Well, I don't know how herbs can manage paralysis. I've never heard of that. So something that I don't want to give you misinformation. So I have to check into that myself. And does he have, I mean, has he worked? Has he worked in a lot of people? Nurse Luro?
So I think what Nurse Luro is talking about, there are some traditional orthopedic homes where they call them arogun. So where they have patients who have maybe different kind of issues, the fractured leg, any part of the body. So they manage, they massage, they bind, so then they give them, in fact, they use some concussion to even rub the outer part of like that particular sport. So for me too, I don't really know what the impact of that. It's not, because I've seen it before, it's not like, it's not as much as the analgesics, all those these ones, but at the same time, they still give them concussions to drink. So, and at the end of the day, they still get healed. So we don't know like what could be behind it and no. So I think that's where it's going.
Yeah, now I understand. So they are actually helping to treat the deficits, you know, because if somebody has a stroke, is it one side, you know, left-sided or right-sided? So depending on the side, the one side of the arm or the legs could have like weakness, or you know, they may not be able to use that, right? But I think in that sense I can understand, because massaging and treatment, you know, orthopedic patients and stuff like that, maybe possibly easier. But you know, this is not something to do with addiction, right? Because they're using they're treating the external part of the body, they are massaging it. And a lot of these homes, from what I was told, I've been informed about, they're a lot cheaper than going to Bobi. You get better treatment than going to somewhere like Bobi. So that's what I've heard. And, you know, I want to be able to use my money and then use it, have a good use of it. So maybe that's the reason why people are resorting into going to this kind of therapy, or, you know, taking their family ones or loved ones to this therapy. But I really have not read much about it. So I think it's something for me that I have to review for future references. And then it says, somebody said, I know a medical doctor that is addicted to the pentacozine, to the extent that if sustained severe injury in her buttock, yet while addressing the injury site, she will be begging the nurses to administer drug to her. And if the nurses refuse, she will give herself, because she goes with anywhere she goes with it. And in case, so as I indicated, Mrs. Okay, this cross across all disciplines, because your medical doctor does not mean you don't use drugs. Because you are even the CEO of a company does not mean you're not using anything. So we can't assume just based on the professional, you know, the profession or the discipline. We just have to treat individuals. So this person, for here, if it's over here, that person would not be practicing, because they have a risk. They are risks to family members. They are risks to their patients. They will have them to go to the rehab. And I'm not sure why would even the organization allow this kind of provider to still be seeing patients. So this will not, and those are the areas that, you know, we need to, you know, improve on in Nigeria. It's not just about the discipline, it's not about the certificate. It's about, is this doctor, is this person, this provider at a risk to our own patients too? Of course. Yeah. So any more questions?
I thank you so very much, Dr. Ejimo. We're so glad to have you, and there is no doubt we've been able to learn a lot from the lecture. So once again, thank you so much. And on behalf of the officers, nurses, and all our students and all the beneficiaries of Ed for Nigeria and our programs, we say a very big thank you to you. So we look forward to having you like this once again, and even more than once again, so that we'll be able to learn from you again and again. And I pray God bless you, be with your family and your career as well. In Jesus' name.
Thank you. Amen. Amen. Thank you so much. Thank you. It's a pleasure coming here. And everybody, you've been very interactive. This is the kind of workshop that I like. I like not just talk. I like to get feedback from you, which I'm getting, which is really good. And so the lesson learned, the key point here is that we nurses go out to the society and make it, we just don't hide in the corner and say, it should be problem one. It's all our problems. So we can all do it. And thank you for inviting me. I think the best way to curtail the use of these substances is to continue with the consequences awareness, because the problem here had been this, since ages here. Thank you. Yes, I agree with you, Ms. Salami. Yes, no Salami. Yeah, so letting people know about the consequences is very, very important. A lot of times people will say, oh, it should be one-time dose. No, it's not just about one-time dose. It's a long-time consequence. And the way my body reacts to it, I may take only one sip and you may take only another sip. You may not even have any touch of you may not feel any touch of the substance. But only one sip for me will drag me into the to the end. So every single person reacts to these substances differently, and so we have to be very, very cautious about that. And that's the preaching that we do, that the teaching that we do, that every single person reacts differently. So I can't take information from one person and say, oh, this is good for me as well. Thank you.
All right, thank you. Thank you, everyone.
Mm-hmm.
All right, and do have a lovely day.
Thank you. Thanks. Thank you.